As we speak, a devastating 3.4 million children worldwide are infected with pediatric HIV. Now, even more devastating than this number is the fact that instead of decreasing infection rates over time, we've actually only seen an increase in the last decade alone. Last year, 330,000 children were newly infected with pediatric HIV. The AIDS epidemic is widely regarded as a challenge worldwide, and governments, NGOs, and global AIDS programs are investing heavily in the prevention and treatment of pediatric HIV. In fact, the World Health Organization estimates that $500 million is spent every year on the prevention of pediatric HIV alone. Now, the majority of pediatric HIV infections occur through what is called mother-to-child transmission of the virus. And that is simply when a HIV-positive mother transmits the infection to her child, either during pregnancy, through birth, or during breastfeeding. Now, treatment exists that can drastically reduce the risk of transmission to under 2%. And this is through an antiretroviral medication available in liquid form for infants and children that is given to a mother after birth to take home and give to her child for a period of a few days or up to a few weeks, depending on if she's breastfeeding. Now, like I mentioned, prevention of mother-to-child medication does exist, or PMTCT medication does exist. So why are infection rates only increasing over time? The issue is that PMTCT medication is only effective if administered in the exact dose that the child is prescribed. Now, this seems simple enough, but studies have shown that 40 to 60% of caregivers, even in the US, make errors when administering liquid medication to their children. These dosing errors can be due to standard issues, such as using inaccurate tools like dosing cups or measuring spoons. But in developing countries, the challenges to dosing are exacerbated when issues such as poor electricity, illiteracy, and lack of dexterity become significant challenges. Misdosing PMTCT medication is incredibly dangerous, as not only does it prevent the risk, the effective prevention of HIV transmission, but can also lead to drug resistance, so that even if that child is infected with pediatric HIV, standard antiretroviral medication is no longer effective for treatment. And in cases, it may even lead to death. We are here today with a product that can leverage the millions of dollars already being spent on PMTCT programs across Africa and to make a direct impact on reducing HIV infection rates among children worldwide. Megan is going to tell you how DoseRight can accomplish exactly that.
As Faria said, DoseRight has the solution to problems with misdosing. DoseRight is a plastic clip that is inserted into the barrel of an oral dosing syringe. The clip acts as a stopper that prevents the user, it ensures that the user draws up the exact amount of medication prescribed. The clip does not touch the medication. It is safe and hygienic. And it's a very low cost. For only 10 cents, a healthcare provider can use a simple tool with a very high impact. Currently, in Africa, caregivers are using tools that are both inaccurate and difficult to use. When we were in Liberia, we saw firsthand that the majority of caregivers use spoons to dose their medication to children. Spoons come in a variety of sizes and are incredibly inaccurate. There are some more accurate tools available, such as dosing cups, oral syringes, and droppers, but they can be difficult to use. The average healthcare worker in Africa may have an elementary school education, so understanding the prescription of giving 1.5 cc's to their child can be very perplexing. Luckily, DoseRight is the perfect alternative to all current dosing tools. It is easy to use, it is safe, and it is accurate. DoseRight would be a valuable contributor to any PMTCT program. It maximizes this program's current resources. As Faria said, to prevent the transmission of HIV from mother to child, the exact dose of medication must be given. DoseRight enables that. DoseRight also simplifies the role of healthcare workers. It is easy to teach, it is very easy to use, and the different colors for different doses makes it very easy to standardize across programs. DoseRight has been proven successful in Swaziland. In 2011, with a partnership between the Swazi Ministry of Health and the Clinton Health Initiative, brought 250,000 clips into the country. Earlier this year, another large order was placed. In Swaziland, they've been using these clips exclusively for PMTCT, and then healthcare workers have claimed that it's a very effective tool and it's helping ensure the accurate benefit of PMTCT protocols. I'm now going to pass it on to Ben, and he's going to tell you about how we've planned to expand DoseRight and get it into the hands of the millions of others who could benefit from this tool.
Thanks, Megan. Okay. On our research on the ground in Africa, we discovered that there's really not a huge demand for DoseRight outside of the PMTCT market. We also realized that if NGOs will endorse our product, it's much more likely to get on government purchasing lists. So we initially started looking at markets where there are established PMTCT programs and that there's a strong NGO presence we can work with. We further decided to narrow target markets to countries with high adult HIV rates, meaning over 10% of the population, and also countries with relatively easy distribution systems, which is particularly important in a continent not known for its easy logistics. In order to judge our ease of distribution, we created a metric of sales per square kilometer of countries. So taking the projected statistics from Swaziland, we projected potential markets in our target market to see how much they would sell of clips per year, and then overlaid that with the size of the country. So as you can see, the first country we went into was Swaziland for the pilot, and it's a very dense country. While it's not a ton of clips sold, it's very small and allowed us to roll it out very quickly. And then it goes up the list from Lesotho, Malawi, and up through South Africa, which looks like it's in the middle, but it's the largest country, but it's a larger one. So taking all of the research we did on our target markets, we came out with a rollout plan. So we're moving from Swaziland up to the east in Malawi and Zimbabwe, and then crossing over to the west, the whole time encircling the largest and most sophisticated market of South Africa and Lesotho. So we want to make sure that our product is proven and has a great track record before entering the most sophisticated markets in South Africa and Lesotho. Now, we're planning on doing this by running a lean organization comprised of MBA volunteers. They'll hopefully be graduates by this point. We'll see how that works out. And we'll have a web order system that will allow countries that after our business development to place orders through our web order system, which we will transmit directly to manufacturers we've lined up in China, who will then ship the product directly to the NGOs and governments who will be distributing it. We will measure our success based on traditional financial metrics as well as our social impact. This lean organization allows us to supply DoseRight clips quickly and efficiently, and we want a DoseRight clip to be available at any time a PMTC regimen is prescribed. Now for the important part that you've all been waiting for. We only need $136,000 to get off the ground. Most of this cost is for molds, and molds that can produce millions of clips are expensive, unfortunately. We'll also need trade financing to pay for the product before it gets to Africa and we receive our funds back. We'll also be developing a website and making business development trips in order to sell our clips. We hope to be in Malawi within the first few months and then expanding from there. Now my eye goes to this 0.67% initially, which doesn't look like a very high return number, but it's a conservative estimate and there is upside. Admittedly, this isn't the best financial return, but what we make up for that with a high social impact. DoseRight will help prevent the misdosing of PMTCT medication, increasing the effectiveness of this treatment, and lowering AIDS rates of children in Africa. So, we're the DoseRight team, and we invite you to invest in a healthier Africa. Thanks.